The purpose of the short training course is to assist you, the employee, in looking after yourself during these unprecedented times. It will inform you on how to avoid contracting COVID-19, how to spot the symptoms in the unfortunate event you do contract it, and what steps to take next. Your safety and well-being is paramount to LIT. COVID-19 is an illness that can affect your lungs and airways, cause serious illness, and in some cases prove fatal. It is caused by a virus called coronavirus. It is vital that we all learn to combat this virus and play our part to keep LIT COVID-free. Remember, if staff and students minimise their risk of exposure to COVID-19 in their life off campus, this reduces the likelihood they will become infected and introduce the virus onto campus. Apply the following information to your work and personal lives. To combat COVID-19, we must understand how it is spread, how to spot the symptoms, and how to protect ourselves. How is COVID-19 spread? The virus is spread from one person to another by an infected person releasing fluid or droplets by sneezing, coughing, or speaking when in close contact with another person. Touching surfaces that someone who has the virus has coughed or sneezed on, and bringing your unwashed hands into contact with your face. The fluid or droplets must then enter our mouth, nose, or eyes for us to be exposed. Close contact is defined as spending more than 15 minutes of face-to-face contact within 2 meters of an infected person in any setting. Living in the same house or shared accommodation as an infected person, or sitting within 2 seats of an infected person in any direction on an airplane. What are the symptoms of COVID-19? Common symptoms of COVID-19 include a fever, which is a high temperature of 38 degrees C or above, a cough, this can be any kind of cough, not just a dry cough, a shortness of breath or breathing difficulties. There is also evidence that a loss of taste and or smell can be experienced. It can take up to 14 days for symptoms of COVID-19 to appear, and they can be similar to symptoms of cold and flu. Some people infected with the virus, so-called asymptomatic cases, have experienced no symptoms at all. Caution: do not come to work if you have any symptoms of COVID-19. Also, do not come to work if you have been diagnosed with COVID-19, are awaiting COVID-19 test results, or have been in close contact with a confirmed COVID-19 case. You should immediately self-isolate and contact your GP. If you feel unwell while at work, inform your manager immediately by email or phone. Put on your face covering. Leave the building as soon as possible with your manager's permission. Do not engage in any contact with colleagues or students. Do not use public transport to get home. Contact your GP as soon as possible. If you cannot go home immediately, inform your manager and an isolation room will be arranged. Contact tracing. Staff should keep a personal daily contact log of persons they have had close contact with, including person's name, date, and locations. This data can be used for contact tracing purposes. Please remember, close contact is defined as spending more than 15 minutes of face-to-face contact within 2 meters of a person in any setting. It is strongly advised that all staff download and use the HSE COVID Tracker app. COVID Tracker is a free app for your mobile phone. It will help to protect each other and slow the spread of COVID-19. How do I protect myself from COVID-19? The best way to prevent the spread of COVID-19 is to use proper hand hygiene, practice respiratory hygiene, and practice physical distancing. Hand hygiene. Wash hands thoroughly and regularly and avoid touching your face with your hands. You should wash your hands after coughing or sneezing, before and after eating, if you are in contact with someone displaying signs of sickness, after touching potentially contaminated surfaces, and before and after wearing gloves. You should also wash your hands before and after being on public transport, before and after being in a crowd, when you arrive and leave buildings including your home, after changing work task, before having a cigarette or vaping, after touching any high contact surface. In the next slide, you'll see a short video on how to wash your hands properly.
Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam, then rub right palm over the back of left hand with interlaced fingers, and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm, and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm, and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow operated, use this towel to turn off the tap without touching it directly. Your hands are now clean and safe.
Using hand sanitizer. Apply hand sanitizer in the same manner as you would wash your hands, thoroughly covering all areas of the hands. Apply it in all the previously mentioned situations also. If hands are visibly dirty, wash hands with soap and water prior to using the sanitizer. Hand sanitizer is a good substitute if soap and water are not available to wash your hands. Respiratory hygiene. Practice good respiratory hygiene at all times. When coughing or sneezing, cover your mouth and nose with your bent elbow or a tissue. Do not cough or sneeze into your hands. Place the used tissues into the bin and wash hands thoroughly immediately. Physical distancing. Physical distancing, also known as social distancing, aims to decrease or interrupt the spread of COVID-19. This is done by minimizing contact between potentially infected individuals and healthy individuals. The current recommended distance to be maintained between people to minimize a risk of transmission is 2 meters. There is very little risk if you are passing someone briefly in a corridor, but try to keep a distance of 2 meters where possible. Where the 2 meter distance cannot be met, a face covering must be worn, and a minimum of 1 meter distance should be adhered to. This applies to all individuals in all settings. Wearing a cloth face covering is essential in situations where it is difficult to practice physical distancing, for example where 2 meters cannot be met. Face coverings may help prevent people who do not know they have the virus from spreading it to others. Each individual must wear a face covering in any situation where they feel there is a lack of physical distance and in crowded or congested areas. Face coverings should be a minimum of 2-ply and be washed daily at a minimum temperature of 60 degrees with detergent. You do not have to sterilize face coverings. Wash it in a washing machine or by hand as you would any other item of clothing. You should wash your hands before and after using a face covering.
How to safely wear a face covering. Wash your hands well with soap and water before putting it on. Without touching the front, put it on so that it covers your nose and mouth. It should go right over your nose and the bottom of your chin. Hook or tie the covering straps so that it fits closely and well to your face. Avoid touching your eyes, nose and mouth at all times. Take the covering off from behind. Store it in a plastic bag until it can be washed. Once it is off, wash your hands well with soap and water. This is very important. Wash your covering regularly with normal detergent in a normal wash. Don't forget, a face covering may help prevent people who do not know they have the virus from spreading it to others. It is not a replacement for washing your hands or keeping the 2-meter distance.
Personal protective equipment. Consult with your manager and department risk assessments on the requirement for PPE within your area. While correctly using PPE can mitigate some exposures, it should not take the place of other preventative measures as outlined in this induction, for instance physical distancing, hygiene measures, etc. Gloves should not be used as protection against COVID-19. Gloves should only be worn if they are a requirement of your normal work activities, for example caretakers or lab work. Face visors can be worn in lieu of face coverings, in line with the HEI sector guidance document. General precautions for protecting ourselves against COVID-19 include avoiding crowded places, avoiding the sharing of work equipment, food items, cutlery, etc., cleaning and disinfecting frequently touched surfaces, avoid touching your eyes, nose and mouth, do not share passenger lifts, do not congregate in groups, and do not shake hands or make unnecessary physical contact. When using welfare facilities such as the canteen or toilets, allow appropriate time and space to facilitate the correct levels of hygiene and physical distancing. Be mindful of physical distancing measures. You must respect the space available to ensure physical distancing. This may require a longer wait. When travelling to work, it is preferable that you do so alone. Avoid public transport if possible. If this is not possible, avoid sitting too close to others, avoid touching surfaces such as handrails. Bring hand sanitizer and wear a face covering as per public health advice. If you must carpool, sit as far apart as the vehicle allows. Keep windows of vehicles open, at least partially. Cover your mouth and nose when coughing or sneezing. Wipe regularly touch points in the car. Wash your hands before and after travelling, and all occupants should wear face coverings. Look after your mental health. The current pandemic situation can be very worrying and can affect your mental health. Communicate regularly with your manager, colleagues and family, and utilise the LIT EAP service provided for you and your family. Contact Human Resources for details. Risk assessments and control measures. Risk assessments and walk-arounds have been carried out and control measures implemented across LIT, such as reduced capacities in rooms, rota systems and working from home, physical barriers and screens, hand dryers have been replaced with hand towels, ventilation and air conditioning systems have been serviced and adjusted accordingly, increased cleaning regimes have been implemented including high touch points, sanitising and cleaning materials have been provided throughout, and there has been increased signage implemented throughout it also. If you have any concern regarding your working environment, please contact your manager. COVID-19 can make anyone seriously ill, but for some people the risk is higher. There are 2 levels of higher risk: very high risk, also called extremely vulnerable, and high risk. There is different advice to protect people in each group. The very high risk people should follow the advice on cocooning. The high risk people should follow the advice on how to protect themselves from coronavirus. You should refer to the HSE website and follow the public health advice. Contact your GP if you are concerned or confused about your status in either of the high risk groups. Finally, look after yourself and others. Practice physical distancing, hand hygiene and respiratory hygiene at all times.